From the Baker Institute for Public Policy at Rice University in Houston, Texas, this is Baker Briefing. I'm Ed Emmett, Baker Institute Fellow and host for this briefing. Today's topic, childcare, the cost of childcare, the necessity of childcare. In today's world, childcare is a necessity for many families, and I know when I was a child, it was assumed that there would be a parent at home until the children went off to school anyway. I remember churches and other organizations created Mother's Day Out. So it was assumed that there was going to be a parent and usually a mother at home. That's not the world we live in today, though. So the concern is that child care in the U.S. might be at a tipping point. 34 states in the District of Columbia, the average annual cost of infant center-based care is actually greater than the price of in-state public college tuition. That's staggering. And on average, American families spend a large share of household income on child care, 13% according to estimates from the Treasury Department. And this September, the $39 billion that had been flowing from the American Rescue Plan Act, that'll phase out, so that money will go away. All these child care challenges facing families in the United States have now spurred government officials at all levels to consider policies to help address these challenges. This is an issue that, like I said, didn't exist when I was a child. So in January, the Baker Institute released a report that explored the question of what are the most practical policy solutions currently available. So today, we're going to get to dig into these solutions, talking about the advantages and drawbacks of each. I'm delighted to welcome my colleague, Dr. Joyce Beebe. Dr. Beebe, thank you for being here.
Thank you for having me.
So let's start. Give us some context about child care in the U.S. How many children need, for lack of a better term, non-parental care, and what does this care typically cost?
So the Department of Education data show us about 40% of the kids before age 6 were exclusively cared for by their parents. That leaves about 60% of the kids of that age group, which is about 13 million kids in the US, who need non-parental care. So for those parents who are looking for care outside their family or themselves, what do? Most commonly, they go to a center-based care, meaning a pre-K or daycare center. That's the most popular arrangement. After that, the solutions are typically, say, family members like grandparents or other people in their family. Or the next one could be the non-center-based care that's not a family member. So typically, that could be a nanny you have to your house, or you can just have a neighbor. So those are the typical arrangements, and the most popular one is the center-based care. And your second question about how much will that cost? As you mentioned earlier, 13% is what the Treasury Department report reviews fairly recently, but generally it's a lot. So how much? It really varies by city. So big cities, generally the cost will be higher than smaller towns, and also, if you care for a younger infant, it's going to cost more than, say, an older child, let's say 5-year-old kid. And finally, center-based care costs more than, say, a relative, or you pay the relative or family member or a neighbor. So those are the general criteria for care cost.
Well, your report goes into great detail, obviously, but it describes some challenges within the industry. High turnover rate among employees.
Right.
It's not the most glamorous job in the world, and relatively low pay. And so even against that background, the cost remains high. So how does that dynamic work? And what role did the COVID epidemic play? I know we see it in restaurants. They're having trouble finding people to work, so I assume childcare is the same thing?
It is. So if you first approach this issue, you would think, well, parents are paying a lot of money, a high percent of their disposable income, and the teachers are paid very little. So something is missing in between. Where did the money go? Some people's first reaction will be, well, Could the center operators be pocketing a lot of profit so the teachers don't pay a lot? And that's not necessarily always the case. It could be true for centers that operate multiple locations and big centers. A group of Federal Reserve researchers actually follow this profitability issue for a long time, even before COVID. And they realize a lot of childcare centers actually operate on very thin margins. So they dig deeper and realize, well, what happened? What's the reason for such thin profitability? And they say that, well, you know what? Childcare industry is actually a very labor-intensive industry, if you will. You do need the facilities, you need to feed the kids, but it's the teachers, their salary and benefit that consists of a large percent of the total care cost. So there are some state regulations as to if you have a certain space, how many kids can you have in this space? And there's also kids to teacher ratio. And so the younger the kid, the ratio for one teacher per kid, how many kids, it's lower basically. One teacher can only care for a certain number of kids. So there's a limit as to how many kids the teacher can care for. So there's the regulation there. And then also there's the cost for liability considerations for caring for kids. So all that add to the cost. And finally, the childcare industry is not like retail or fast food. They can scale very fast or extensively. So there's a lot of individual centers. They are not franchises. And they all tell the parents, we're different, we're unique. So the provider space is very sort of individualized, or there's not a lot of economic of scale, if you will, which means cutting down the cost is hard. And the second part of the question about COVID, in the beginning, as you mentioned, the Paycheck Protection Program tried to have the child care center doors remain open and not cut the labor force that remain, have the teachers still be employed by the centers. So that's that. But as time goes by, there is still some uncertainty. So the teachers just decided, maybe I want to leave the space altogether. I want to go to a different industry where there's possibly more opportunities and higher pay. So some data show as of last quarter of 2023, there's still about less people working in this industry compared with before the pandemic. So the sector has not completely recovered. And that alone, and then you consider all these other factors like a tight labor market, inflation, and there's also the remote work consideration. All these factors are kind of putting pressure on the childcare industry, and also about the supply of the childcare workers.
So obviously high childcare costs demand aren't unique problems to the United States. Are there some lessons that we can learn from other countries?
So typically, we benchmark ourselves against a group of countries called OECD countries. That's Organization of Economic Cooperation of Development. It's basically a group of 38 industrialized countries that are pretty much in the same economic development phase as the US. So they all have some kind of childcare support or subsidy for parents. But in terms of dollar amount, in terms of spending, US spend a lot, but US is also a big economy. So if you consider spending as a percent of GDP, that ratio, the typical OECD country, average OECD country actually spend about 3 to 4 times more than the US if you consider that ratio. So what do those countries do in terms of policy? There are 2 ways they can do it. One is the government just step up and say, I will provide some kind of a childcare support or education directly to the kid. That's government provision directly. And the other way is the government will just come out and say, I will engage the private sector. That's a market-based approach. So government is not directly the provider. So the first case basically has the advantage of government controlling the cost directly, because government can just set the tuition. And the government in some ways can control the quality, and also government can say who is eligible for enrollment, low income, everybody, or everything, something else in between. So that's the government provision. Some OECD countries use that, But the market-based approach, which U.S. uses, is basically government can say, I have some policy tools like the tax credit or cash subsidy, or they can directly subsidize the provider. Those are the two general approaches, but they can use a combination of those. But for OECD countries, no matter what they use, there's a trend. If you break the early childhood space into, say, two groups, very young child, 0 to 2 years old, or 3 to 5 years old, relatively older, OECD countries normally spend a lot more on this older age group, which is 3 to 5 years old. So people were asking, well, why is that case? Why do OECD countries typically spend more on this older age group? Some people say that that's because they decided to focus on this group to get them ready for school, for kinder. Other people will say, you know what, a lot of OECD countries are European countries, and they already have pretty good paid family leave. So they don't really need to only focus on this 0 to 2 years old age group. They can instead focus on that. So that's what our peer countries are doing.
Okay, that's going to lead us back to my introduction. I talked about children when they go off to school, then the child care issue, I won't say it goes away, but obviously during the day, during the school hours, they're taken care of. That's led a lot of people to push for universal pre-K education. So those 3 to 5 year olds you were talking about, if they went to school at age 3, then I guess it's a form of child care. But right now we start at the magic age of 5 or 6 for kindergarten. There's no reason it couldn't start at 3. And I know locally we've had a lot of conversation about that. There's been a constant effort for at least a decade to try and establish some kind of a pre-K program here. The county even recently, actually 3 years ago or so, announced we're going to fund pre-K. Nothing ever came of it. There have been all these efforts. So how does universal pre-K fit into this whole equation?
So the universal pre-K, as you mentioned, it's a policy that's being discussed for a long time. And there's a lot of supporters for this issue or this policy because there's research supporting the positive effect. And generally the research says, well, if you start the kids early, before kinder, starting them with pre-K, it will prepare them for school success. And this positive effect is great, especially among underprivileged kids, low-income household kids. And there's also some research say, well, if you mingle those kids with people from all socioeconomic backgrounds, so you don't only limit the classmates to be low-income kids, the spillover effect or the development effect is even bigger. So that's very appealing from that perspective. But the research continued to grow and then get more refined. And there's a really famous line of research basically says, hey, we want to see if our return on investment is long-term. So you see the kindergarten kids are successful, but how about if we follow them till teenager years or adulthood? Is it still worth it? So the research basically say, well, it is still worth it, but maybe not the way you think. So the research basically says the academic success actually fades over time. But what's left is the behavioral issues or the behavioral success. So the kids, they attended the pre-K in some states, most states, basically they have less aggressive behavior when they grow up, or they're less involved with criminal activities, they are less likely to be disciplined in high school, those kind of things. So the supporters also say, well, you know what, even if they're not successful academically as a result of this, there's still positive effect. So that's the line of research that supports that. But that's not a silver bullet for everything, because is there any sort of counter argument for doing that other than the cost? There is some research, say, for example, about 15 years ago, Quebec, Canada, implemented the pre-K, universal pre-K. And right after they start the program, parents report bad outcomes. They say, well, my kids are sick more, their health outcome decreased. They're more likely to be absent from school, and then they're also more aggressive. So researchers were really confused about why this is happening. So fairly recently, because we accumulate enough years of data, the researchers started to figure out, well, if we trace those kids all the way to today, from the beginning of the pre-K, what happened? Does the bad outcome also stick with them? And they found, yes, they do. They are also more likely to be having bad health outcomes when they grow up, and they're more likely to be aggressive. So the researchers ask, oh, what happened? So their conclusion is, well, universal pre-K, there's a lot of good effect, behavioral or other things, but the bad effect, if it's not done properly, it also stays with you. So you really need to be very careful, not rush into this issue. So implementation, careful design is important.
Well, of course, we won't get off into this in this program, but the whole public education system has become very political, shall we say, and we hear a lot of politicians talking about it, and so we have to talk about dollars. If you talk about policy solutions that support families directly, tax credits, are those a good idea, and how valuable is that approach?
So tax credits basically go to a different route from, say, pre-K or other things because it goes through a tax system. And that means typically you go to collect your dollar once a year. And currently there are two major approaches that go through tax credit route. One is the dependent care tax credit. The other is the child tax credit, which is really popularly discussed right now. But the policy goal, I would say, is slightly different, or who they are intended to help. The first group is basically trying to say, if you have childcare expenses, you can go through your tax return and then deduct those expenses against your taxable income and get a credit out of it. This policy is not very expensive, but some people dislike this policy because it's only aiming for people who work. If you're trying to help family overall, regardless of whether both parents work, that policy is going to, say, discriminate against stay-home parent, if you will, because the stay-home parent don't get paid for caring for child. So this is the first counter-argument for disapproving that one. And also, some people say, well, lower income household may not incur as much childcare expenses as higher income households, so maybe they don't get help that much. So that's the argument for and against the first one. And the second route, child tax credit, the biggest supporters of this policy basically say it's very flexible. Parents can do anything with the money they get from the government. And during the pandemic, ARPA actually extended that from $2,000 to $3,600. And they also make IRS sending out the check monthly instead of annually. So that's really unique. But basically, the problem or the challenge about that is it's a very expensive policy. So the estimate basically shows this is going to cost over $100 billion a year. And if you extend that for 10 years, that's over $1 trillion. So those are the considerations for thinking about that. The proposal currently, I think, being discussed, it's not to extend the child tax credit to that much. It's just increased a little bit for the refundable portion. So it's not that expensive, but supporters really like the flexibility about it.
But we live in a world where certainly the federal government is running huge deficits.
Exactly.
People are really beginning to question. And again, here locally, a program just started where they almost randomly selected certain zip codes and said, if you live in that zip code, you can go in a pool and maybe we'll draw your name and give you $1,500 a month for 18 months or so. Are those sustainable? In the political world we live in, are we going to be able to just say, okay, we're just going to give money to people and do with it what you will?
I definitely think the most important thing is, because we have all these policies, we have to really decide who's the target group we're trying to help. Is it working parents only? Is our goal to help mothers' labor force participation? Or we're just going to, like you mentioned, that's probably similar to the UBI idea, universal basic income. So we give them some cash and see if we can relieve their constraint for spending, so without limiting what they can spend on. So all these policies are having different target groups. So we need to think about, do we want to help everybody or just low-income families, or do we want to help working families or whoever? So that's a goal I think we have to first decide. But I do believe universal pre-K or something similar in terms of spending level is not something we should take on lightly. And especially if you mention like universal pre-K, it's a federal or local engagement from the government. You don't want to have this policy only for a year or two and then say, well, sorry, we run out of money, because you have to have the infrastructure, the teachers, and the curriculum. And once you get into this, it's not something you can withdraw that easy because kids' benefits are on the line.
Well, as we started, society has changed a lot in 2 or 3 generations. We could talk about this all day, but what's the final word from you? What does your research predict? Where do you see this going?
I would like to offer some kind of development at the state level. So basically, about this time last year, there's a lot of childcare advocacy groups. They went to the state lawmakers and say they want to extend the pandemic era relief program by another year because they believe the childcare industry has not been stabilized enough. And that did not get enough interest from the policymakers, so that didn't really pass. So instead, what happened at the state level was Proposition 2 from last November, basically that allowed the city and county government to offer property tax relief to the child care service providers. So what happened after that was that the city of Austin offered property tax exemption for child care service providers. And that could be a policy option that policymakers consider going forward at the state or local level, because Texas doesn't really have personal income tax, so we can't really offer, say, tax credit or those kind of things at the income tax level. So other than that, I do think no matter what policy state or local lawmakers consider, we do have to consider the lower income group or people from disadvantaged households, because those families are probably least likely to have enough resources or sufficient resources to find affordable, available childcare. So that's something for us to all consider going forward.
Hopefully your extensive research will continue to guide policymakers. There aren't going to be any easy answers, but I sincerely appreciate your being with us today.
Thank you.
Baker Briefing is brought to you by the Baker Institute for Public Policy, which provides meaningful policy analysis on the most critical challenges facing Texas, the United States, and the world. Baker Briefing is produced by Victoria Jupp and Shannon Moriarty. AV production is led by Kevin Young. The production lead for this episode was Grayson Beaubien. To learn more, including how you can attend a live podcast recording on the campus of Rice University, visit us at bakerinstitute.org. And thank you for listening.